It's the right to accessible, affordable, quality care, which is the hallmark of Whitney M. Young.
The mission is very special.
We provide quality health care to people in need.
I would describe it as a holistic healing center.
We do the best for patients when we treat them in their entirety, not by parts of the body.
We're able to fit them into the schedules and to start educating them to become regular patients, to not just use us as an episodic center.
Often it's a factor of financial ability to support their own care.
You can go to Whitney Young regardless of what type of health insurance you have or what type of coverage you have.
While Whitney might be in an area that is low in income, the value that it has and the services that it renders are the same services that you would receive at any other medical facility in the city or anywhere else.
Well, before we establish a center, we look at the data regarding a community in terms of the needs and access that people have.
And because of the birthing of a place like Whitney M. Young, they were intentionally placed in areas that were underserved, if not unserved.
Having the medical building here makes it very convenient for our population.
We get a lot of patients who will walk, down the street to their appointments at Whitney Young.
This is a first-rate facility. It's bright, clean, cheerful. The staff have been consistently very warm and welcoming.
One of the key factors that we have to adhere to is having the majority of our board members here at Whitney Young be people who use a clinical service.
The whole effort here is to make certain that we bring people into the healthcare system.
The challenge for anyone, particularly in the primary care environment today, is to make sure that we are adapting to patients' ability to manage their care outside of our walls.
At Whitney Young, we take the time. We do speak to the patient.
If you're not a native English speaker and you need somebody who speaks another language, having that ability is really important.
We have translators in place, so no one goes back home without a service being provided just because you can't understand what they're communicating.
Because of the comprehensive nature of what we provide and the quality of service that they receive, they prefer to be here rather than, a competitor that may focus on more of a commercially insured population.
Our mental health services, our addiction services, both drug and alcohol. We have a pretty large HIV program, a methadone program. We've begun to help folks with hepatitis C.
We are a level 3 patient-centered medical home, which is the highest level you can achieve.
People are living longer, and this is happening through education that provide and the technology that's being advanced in healthcare.
And I think that's our strongest point that we have is education and doctors who care.
One of the key components of keeping a population healthy, whether it's our patients or others, is them being informed about their disease.
You can't take care of your own care if you don't know what to do.
I think the legacy of Whitney Young is what informs us today still.
He had an individual who, as a leader of the Urban League, understood that it was serving all people that should be our goal.
Whitney Young was a social activist. That sense of wanting to make a difference in his community at the time and us wanting to make a difference is really key to who we are.
I think it's the connection that they offer, which is the first step in the process to make certain that people are connected to a standardized care, in this case, quality, professional, compassionate care.
There's no wrong door here at Whitney Young to how we get people to engage in the level of care that they need.
We have patients that will come through the door can't afford the medication. My job is to go and to find out where does patient get their medication and for free.
Anybody can come to Whitney Young. It's regardless of income.
I do know that Whitney Young makes a difference, and so it's worth it to me to be part of that.
It's named after a person who has a great legacy. I wanted to continue that legacy.
It has always been a great place to work.
It's like being in a fraternity, and there is a bond, there is a sense of purpose that those of us that work in community health for many years feel.
I used to work at another facility, and unfortunately that was like the last step for HIV patients. So I decided that if I could save one person before they get to the end of the road, it'll be fulfilling.
If one of us hurts, we should all feel the pain. And I think it's important to carry on with that sense of stewardship.
The direction that they're taking now, I think their leadership is outstanding, and I think it's really a gem for the Capital Region.